Norm, people that come to see the doctor for headaches, what's the most common type that they are having?
By far the most common headache that the people come to see us are going to be migraines. That's also true in the emergency room. But at home, if you looked at the type of headache that people have, by far the most common type of headache is tension type. In fact, at any one time, probably 40% of headaches that people have at home are going to be tension. And again, that 16% of headaches are really migraines. But in the office, anybody that comes in with a headache that's bad enough to bring them in to see us, that really wants attention and medication and treatment, by far it's going to be a migraine.
So the migraine headache, how do you diagnose migraine headaches?
The migraine headache is really based upon what the story is. And the story that we listen to of what people tell us is critical. So what I do is have kind of a checklist. And one part of the checklist is location, one-sided or bilateral. The classic migraine, one-sided, but up to 50% can be bilateral.
Whoa.
Well, many of them will be unilateral. Then we ask for not only the location of it, but also we want to know about the severity of it. Is it severe enough to interfere with activity? And a typical migraine will interfere with activity. We also want to know that when they have the headache and they just walk around, does that make it worse? And what the story is all the time, we hear that the headache is really worse with activity. So a typical migraine is going to be a headache that is one-sided, severe enough to interfere with activity. It is worse with activity. They usually puts them to bed.
Steady or throbbing pain?
And it's throbbing. And that's the other thing that's very important. So 2 of those 4 criteria, besides unilateral, throbbing, worse with movement, and severe enough to interfere with activity. Then we add on either nausea or vomiting, and up to a third of the people with migraine won't have any vomiting. So it's not seen in everybody. And then the other one is sensitive to light and noise. So a classic migraine could have all 4 of the first, nausea and vomiting, but also sensitive to light and noise. And that's the criteria for migraine.
If those go untreated, how long do they last usually?
Typically by the conventional, they last at least 4 hours up to about 72. So they last for a long time.